So hello everyone. Am I audible? Okay. So welcome to the part 2 of FMG Accelerate batch. So part 1 we've done some days back. We're finishing with part 2 now. I hope part 1 is clear to all of you. Students, am I audible? Am I visible? Hello to all of you. I'll just type this. Am I audible? Okay, fine. So we'll continue with the series of MCQs. Are you ready, students? So we've discussed the upper limb, lower limb and thorax the other day. Today we'll discuss the rest of the MCQs of abdomen, head and neck and neuroanatomy along with the general MCQ. Okay, so let us begin. The following arteries are branches of celiac trunk except, yes students, answer this. Following are branches of celiac trunk except. So before I begin, just tell me what are the branches of abdominal aorta. Branches of abdominal aorta, how do we classify that? We classify as 2, 3, 4 and 5. That's a mnemonic to remember. 2, 3, 4, 5. Branches of abdominal aorta. So what is 2? 2 are terminal branches. Terminal branches. At what level does the aorta give these terminal branches? L4. So 2 terminal branches at L4. And what is that? That's the common iliacs. Common iliacs. 3 ventral branches. 3 ventral branches. Which are those? One is the celiac trunk. Celiac trunk. What is the vertebral level? T12. And what does it supply? The foregut. The second one is the superior mesenteric artery. What's the vertebral level? L1. And what does it supply? The midgut. And the third one is inferior mesenteric artery. The vertebral level is L3. And what does it supply? The hindgut. The hindgut. Okay. So these are the 3 ventral branches of abdominal aorta. Coming to 4. What is this 4, students? This 4 are the lateral branches. Lateral branches and lateral branches are paired. This is very important. Student, ये MCQs बहुत important है. So branches of abdominal aorta we are discussing 2 terminal branches, 3 ventral branches, celiac trunk, superior mesenteric, inferior mesenteric artery, 4 lateral branches. One is inferior phrenic, middle suprarenal, renal and gonadal. So lateral branches are inferior phrenic, middle suprarenal, renal and gonadal. And 5 dorsal branches होते हैं abdominal aorta के. What are those 5 dorsal branches? There are 4 lumbar arteries. ये pairs में होता है, 4 pairs of lumbar arteries and 1 N sacral artery. Median sacral artery. So 4 pairs of lumbar arteries and 1 median sacral artery. So these are the branches of abdominal aorta. Now understand the celiac trunk. Celiac trunk. I'll just write this down for you. Celiac trunk. This is very important. Celiac trunk. You should know this. Celiac trunk gives 3 main branches. You get many MCQs on this. One is the left gastric. Second is the splenic. And the third one is common hepatic. Okay, left gastric, splenic and common hepatic. What are the branches of splenic artery? The splenic artery runs on the superior border of the body of pancreas. It gives pancreatic branches, short gastric branches, short gastric branches, and the left gastroepiploic artery. The splenic artery gives 1, the pancreatic branches, Second, the short gastric branches. And the third one is the left gastroepiploid artery. What are the branches of common hepatic? The common hepatic gives three branches. One is the right gastric artery. Second is gastroduodenal. And the third one, which goes to the liver, is known as hepatic artery proper. Okay, now students, clear? So the common hepatic gives one is the right gastric, second is gastroduodenal, and the third is the hepatic artery proper. Gastroduodenal gives further two branches. One is the right gastroepiploid artery, and the second one is the pancreaticoduodenal. Right gastroepiploid and the superior pancreaticoduodenal. Fine, so that's the celiac trunk. याद रखना बच्चों, this is extremely important. Always MCQs are asked. In general, ये जो blood vessels हैं, remember the blood vessels, the arteries, especially the branches of the artery, they are very commonly asked in the MCQs. ठीक है? Okay, answer this MCQ. Sorry. The following arteries are branches of celiac trunk except inferior pancreaticoduodenal, that's wrong. Gastroduodenal, yes. Left gastroepiploid, yes. Common hepatic, yes. The inferior pancreaticoduodenal is the first branch of superior mesenteric artery. That's the first branch of superior mesenteric. Yeah, inferior pancreatic. I hope this is clear, students. Number 25th MCQ is clear to all of you. So let us 26. Let us proceed to the next one. Students, can you tell me what is this? ये क्या होता है? What is this ligament? This is a fold of peritoneum. So anterior abdominal wall say it goes to the liver. What is this known as? This is what we call as the falciform ligament. Falciform ligament. Remember this, falciform ligament. And what is this present within the falciform ligament? Inside the falciform ligament, this is what is known as ligamentum teres. Ligamentum teres होता है ये falciform ligament के अंदर. Just remember this. So what is this trunk here? Look at this. This is what I was telling you. ये है celiac trunk. What is this artery? Left gastric. That's the splenic artery, and that's the common hepatic. This is common hepatic artery. The common hepatic artery gives one is the right gastric. This is right gastric. Second, the gastroduodenal, and third one is the hepatic artery. Fine, clear to all of you? Okay. We go to the next MCQ, students. Which of the following artery is a direct branch of inferior mesenteric artery? So what are the branches of superior and inferior mesenteric artery? What is the superior mesenteric artery supply? The midgut. Superior mesenteric artery क्या supply करता है? Midgut. And the inferior mesenteric artery supplies the hindgut. Let us understand the branches of superior mesenteric artery. Okay, superior mesenteric artery. This one, the first branch. You get an MCQ like this. The first branch of superior mesenteric artery is inferior pancreaticoduodenal artery. Inferior pancreaticoduodenal. Then vaginal and iliac branches. Third, middle colic. Right colic. Ileocolic. So inferior pancreaticoduodenal, vaginal and iliac branches, middle colic, right colic, ileocolic. Ileocolic gives two branches, one is ascending and the other one is descending branch. The descending branch of ileocolic gives four branches. A very important MCQ, very important. One is anterior cecal, posterior cecal, appendicular. The last one is iliac. Anterior cecal, posterior cecal, appendicular artery and the iliac artery. So ये MCQ आता है. Appendicular artery is a branch of what artery? The appendicular artery is a branch of descending branch of ileocolic. Okay, याद रखना. It's a branch of superior mesenteric. Okay. Now coming to the next artery, inferior mesenteric artery. What are the branches of inferior mesenteric artery? One is the left colic artery. Second is sigmoid branches, and the third one is the superior rectal artery, superior rectal artery. The left colic, the sigmoid branches, and the superior rectal artery. These are the branches of inferior mesenteric. Here, bachcho, are you able to follow this? Just remember this blood vessels, they are very important. So MCQ देखिए, which of the following artery is a direct branch of inferior mesenteric artery? So what is the answer for this? That's a superior rectal artery. The superior rectal artery is a continuation of inferior mesenteric. Inferior rectal artery is a branch of internal pudendal artery, which is a branch of internal iliac. Internal iliac की branch है internal pudendal. Inferior epigastric artery is a branch of external iliac. Middle rectal artery is again a branch of internal iliac artery. Okay, clear to all of you? Just remember this MCQs. Huh? Remember the options also. Fine, students? Clear to all of you? Let us proceed to the next MCQ. All the following are contents of spermatic cord except. Yes, any answer for this? Can anyone answer this MCQ? All the following are contents of spermatic cord except. Ductus difference, vas difference, yes. Pampiniform plexus of veins, yes. Testicular artery, yes. Ilioinguinal nerve, no, that's wrong. Ilioinguinal nerve is not a content of spermatic cord. Ilioinguinal nerve is a content of inguinal canal. Students, वो spermatic cord के बाहर होता है. It's outside the spermatic cord, but it's within the inguinal. It's within the inguinal canal. Okay, I'll just write this down for you. Inguinal canal. Inguinal canal. What are the contents of inguinal canal in males and females? Okay, in males, it's the spermatic cord. It's the ilioinguinal nerve and spermatic cord. It's the ilioinguinal nerve and the spermatic cord. In females, it's the ilioinguinal nerve and the round ligament of uterus. Okay? So contents of inguinal canal in males, spermatic cord. In females, the round ligament of uterus with ilioinguinal nerve. Now, what are the contents of spermatic cord? Spermatic cord में क्या होता है? Spermatic cord में क्या होता है? One, vas difference, testicular artery, following the students, artery to the vas, cremasteric artery, pampiniform plexus of veins, genital branch of genitofemoral nerve, lymphatics from the testis. Here are bacho. So what are the contents of spermatic cord? It's a vas difference, the testicular artery, the artery to the vas, the cremasteric artery, the pampiniform plexus of vein, the genital branch of genitofemoral nerve, and the lymphatics of testis. And students, the lymphatics of testis, they drain into which lymph nodes? ये मैंने बोला आपको. I've told you this. The lymphatics from the testis drain into the para-aortic lymph nodes. ठीक है ना? And all the structures are put together, all the structures are tied together, and this becomes what? The spermatic. This is what we call as the spermatic cord. Clear to all of you? Okay. Students, are you there? All of you? Come on, answer this. Are you able to follow this? So what is the answer for this MCQ? Ilioinguinal. All are contents of spermatic cord except the answer is going to be ilioinguinal. I hope you are able to follow this. Agar kuch doubts hai, just let me know if there is any doubt. If there are any doubts, just let me know. Huh? Fine? Okay, we'll proceed to the next MCQ. The following peritoneal ligaments are derived wholly or partially from the dorsal mesogastrium except, okay, from the stomach to the anterior abdominal wall, that's the ventral mesogastrium. From the stomach to the posterior abdominal wall, that's a dorsal mesogastrium. Now, who develops in the ventral mesogastrium? Students, the liver. The liver grows in the ventral mesogastrium, right? The liver grows in the ventral mesogastrium. And the moment the liver grows in the ventral mesogastrium, it divides the ventral mesogastrium. The one from the anterior abdominal wall to the liver. What do you call this as? A falciform ligament. From the anterior abdominal wall to the liver, this is the falciform ligament. And from the liver to the stomach, this becomes the lesser omentum. Lesser omentum. Yes, students. Now, the dorsal mesogastrium who develops is the spleen. The spleen forms here. The moment the spleen forms here, the dorsal mesogastrium gets divided into two parts. From the stomach to the spleen, what do you call this as? ये क्या बनता है? Gastrosplenic ligament. And from the spleen to the kidney behind, what is that? Lienorenal ligament. Gastrosplenic and lienorenal. So let us understand the derivatives of dorsal and the ventral mesogastrium. I'll tell you this. I'll tell you. This is extremely important, student. Derivatives of ventral mesogastrium. Ventral mesogastrium. What are the derivatives of ventral mesogastrium? Come on, students. One is the falciform ligament. Falciform ligament. Second is the lesser omentum. Lesser omentum. Third, any guesses? The liver. So liver and the liver is formed in the ventral mesogastrium, and because the liver develops in the ventral mesogastrium, right? To be ligaments there. What are ligaments of the liver are derived from ventral mesogastrium. All the ligaments of liver are derived from ventral mesogastrium. All the ligaments of the liver are derived from ventral mesogastrium. Which are these ligaments? One is the superior and inferior layers of coronary ligament. Superior and inferior layers of coronary ligament. Right and left triangular. Right and left triangular ligament. Students, this is very important. बहुत important MCQ. Remember this. So what are the derivatives of ventral mesogastrium? Once again, going through it once again, the falciform ligament. Okay. The falciform ligament, the lesser omentum, the superior and inferior layers of coronary ligament, the right and the left triangular ligament. So these are the derivatives of ventral mesogastrium. What are the derivatives of dorsal mesogastrium? Students, dorsal mesogastrium में who's forming? The spleen. Spleen form होता है. So from the stomach to the spleen and from the spleen to the kidney. I'll just write down dorsal mesogastrium. These are the derivatives of dorsal mesogastrium. One, gastrosplenic. Lienorenal ligament. Yes, anything else? The greater omentum the last one is gastrophrenic. Just remember the students, these are all the derivatives of dorsal mesogastrium. Some बहुत important MCQs. I've selected all important MCQs for you. So just remember this. कोई भी option लेके MCQ can be asked. Be clear about the options also. Fine. So these are the derivatives of dorsal and ventral mesogastrium. What is the answer for this, बच्चों? What is the answer for this? The following peritoneal ligaments are derived from the dorsal mesogastrium except hepatogastric ligament is nothing but lesser omentum. Gastrosplenic ligament Rhinorenal ligament, gastrophrenic ligament. So dorsal mesogastrium से gastrosplenic, rhinorenal, gastrophrenic. So what is not derived from the dorsal mesogastrium is the hepatogastric. And what is hepatogastric ligament? That is the lesser omentum. That's the lesser omentum. Yeah, fine. Okay. That is derived from ventral mesogastrium. Yes, ventral mesogastrium. Answer this. Come on, students, answer this. Fetal midgut rotates dash degrees in intrauterine. How much is that? Anyone? Anyone? Answer this. How many degrees does it rotate? Fetal midgut? 270 degrees. 270 degrees. Just have a look at this. It's 270 degrees anti-clockwise. 270 degrees anti-clockwise. Just have a look. I'll just explain this for you. Look up. The liver is growing very fast on the right side. Right side, the liver is growing very fast. So there is no place for the midgut inside the abdomen. There's no place for the midgut inside the abdomen. But what does the midgut do? A midgut has a loop banata. It forms a loop like this. And this loop comes outside the abdominal cavity. It forms a loop and it comes outside the abdominal cavity. What is this? No, this is a hernia. Ye hernia hai na? It comes outside the abdominal cavity. It is a hernia. But this hernia is going to reduce. It is therefore known as a physiological hernia. इसे हम बोलते हैं physiological hernia. When does the herniation occur? Another very important MCQ, students. When does the herniation occur? 6 weeks of intrauterine life. The herniation occurs. And when does the herniation reduce back? When does it come back? 10th week of intrauterine life. Okay? So herniation begins by 6 weeks and comes back by 10th week of intrauterine life. Okay? So as the midgut loop is coming back, it undergoes a rotation. This is rotation of the gut. Rotation of the gut yahi hota hai. Now you have to know, students, rotations, how many rotations occur? Like when this midgut loop comes outside the abdomen, it carries the artery of midgut with it. Which is the artery of the midgut, the superior mesenteric artery. So, ये midgut loop के साथ who comes in the superior mesenteric artery, it now divides the midgut loop into 2 segments. Those segments बनते. One is above the artery. What is that? The pre-arterial segment. And one is below the artery. What do you call this? As the post-arterial segment. Let's look at that slide now. A slide देखना. See the first slide. I see that's a loop which has come out. The one in yellow is above the artery. This is what we call the pre-arterial segment. The one in blue is below the artery. That's the post-arterial. And which is the artery here? The superior mesenteric. The post-arterial segment gives a small bud here. एक छोटा सा bud होता है for the cecum. What is that known as? The cecal bud. This is what we call as a cecal bud. Now rotations will occur like this. So this, when you look from front, it would be anti-clockwise. Anti-clockwise होंगे. तो ये छोटा सा bud क्या है? Cecal bud. This is a point of reference. Okay, I'll begin. The first rotation is 90 degrees. Here like this. So the pre-arterial segment जो ऊपर था, it goes on the right side. Look at the second slide. The pre-arterial segment is on the right side. The post is on the left side. Now this pre-arterial segment forms small intestine. Forms the small intestines. Look at the third slide. This small intestines are coming back to the abdominal cavity. As they come back, they undergo a now second rotation. The second rotation occurs by how much? 9. The post-arterial segment is superiorly. See the fourth slide. Cecum is in the midline. And finally, the post-arterial segment is coming back to the abdominal cavity. The last rotation. The last rotation occurs by 9. So where's the cecum now? On the right side. This is what we call as a subhepatic cecum. But when the cecum comes back to the abdominal cavity, it lies below the liver. This is what we call as the subhepatic cecum. Later it goes back. Later it goes down to its right fossa. बाद में ये right iliac fossa में जाता है. So how many rotations have occurred, students? 3. How many degrees each? 90 degrees. A total of 270 degrees of rotation anti-clock. Are you able to follow this, students? Are you able to follow this? Look once again. The pre-arterial segment and the post-arterial segment, and that's a cecal bud. The first rotation 90 degrees, pre is on the right, post is on the left. Pre-arterial segment forms small intestines. small intestines are returning back into the abdominal cavity. Second rotation. The second rotation by 90 degrees. Post arterial segment superiorly, cecum in the midline. Now the post arterial segment is returning back. Third rotation. The third rotation is by 90. The cecum right side, that's the subhepatic cecum. Dear students, are you following this? A total of 270 degrees of rotation, a midgut loop. Fine, bacho. Yes. Respond, answer, keep on answering. Be interactive, students. Be interactive. Be interactive. So then I come to know. Okay. So what is the answer for this MCQ? वापस देखिए. Fetal midgut rotates dash in intrauterine life. That's 270 degrees of rotation anti-clockwise. आप सामने से देख रहे हो ना, you're looking from front, so it is always going to be anti-clockwise. Fine. Okay, I hope things are clear, students. Things are clear, I hope. Answer this. To access the lesser sac. Where is the lesser sac, बच्चों? Lesser sac होता कहाँ पे? It's behind the stomach. है ना? Lesser sac is right behind the stomach. To access the lesser sac, the surgeon identifies the lesser omentum. Okay. The surgeon identifies the lesser omentum. The hepatic artery, bile duct, and the portal vein lies within the lesser omentum. Fine. Lesser omentum. Hepatic artery, portal vein, bile duct. One of the following statements about portal vein is true. Okay, so I'll just tell you something about the portal vein. थोड़ा सा portal vein के बारे में अपन discuss करते हैं. And then, look, what is this now? That's a duodenum. That's a C of the duodenum. What is this? That's a pancreas. Pancreas, that's a head, neck, body and tail. And what's that? Spleen. And what is this process of the pancreas? ये है uncinate process. Uncinate process of the pancreas. Right? Now students, there's a vein behind the body of the pancreas. Yes, any guesses? What is this vein behind the body of the pancreas? ये कौन सी vein होती है? That's the splenic vein. The splenic vein lies behind the body of the pancreas. Right? What is this vein which lies on the uncinate process? This vein also lies over the third part of duodenum. What is that? ये क्या होता है? That's a superior mesenteric vein. Just remember, students, the superior mesenteric vein lies on the uncinate process. The same superior mesenteric vein crosses the third part of the duodenum. It goes behind the neck of the pancreas. अब ये neck के पीछे गया superior mesenteric vein. It joins with the splenic vein. Joins with the splenic vein and forms what? Portal. ये बन गया portal vein. So that's where the portal vein is formed. And now the portal vein goes up. So where is the portal vein formed? The portal vein is formed behind the neck of the pancreas. That's the neck of the pancreas. And how is the portal vein formed? By the joint of two veins. ये कौन है? That's a splenic vein and ये है superior mesenteric. Right? The portal vein is formed behind the neck of the pancreas. Now the portal vein के तीन parts होते हैं. There are three parts of the portal vein. That's the duodenum. The first part is above the duodenum. The first part of the duodenum. That's the supraduodenal. The second part of the portal vein is behind the duodenum. That's the retroduodenal part. And the third part is below the duodenum. That's the infraduodenal part of the portal vein. The supraduodenal, the retroduodenal, and the infraduodenal part of the portal vein. समझ में आ रही है? The supraduodenal part of the portal vein lies in what? What does this lie in? Lesser omentum. That lies in the lesser omentum. The retroduodenal part of the portal vein lies behind the first part of duodenum. The first part of duodenum के पीछे होता है. And the infraduodenal part of the portal vein lies behind the neck of the pancreas. Fine. That's about the portal vein. Okay. Look at this. One of the following statements about portal vein is true. One is true. It ascends inside the hepatogastric ligament. What is hepatogastric ligament? That's the lesser omentum. That is lesser omentum. So it ascends inside the lesser omentum till the hilum of the liver. That is correct. Origin, so this is correct. ये बराबर है. That's correct. Origin is behind the head of the pancreas. Students, what do you say? What do you say? Where's the origin of portal vein? It's behind the neck pancreas. Students, it's not head. Head के पीछे नहीं है. It's behind the neck of the pancreas. Neck. ascends behind the second part of duodenum. Is it correct? The portal vein goes behind the first part of duodenum. Students, first part, not the second part. Look, this is the first part of duodenum. So it ascends behind the second part is wrong. It's the first part of duodenum. And located anterior to the bile duct. No, that's wrong. In the less omentum, there are three structures. Less omentum के अंदर तीन structures होते हैं. सबसे पीछे, the most posterior is the portal vein. To the right of the portal vein, is the bile duct, and to the left of the portal vein is the hepatic artery. Left is the hepatic artery. So सबसे पीछे portal vein, to the right is the bile duct, and to the left is the hepatic artery. So option number 4, the portal vein is located anterior to common bile duct. That's wrong. The common bile duct is in front of the portal vein. It's to the right side of the portal vein. It's to the right side of the portal vein. I'll show you the slide. Look at this, students. Look at this slide. ये क्या है? Seen here. This color is not seen. What is this that I've drawn? ये क्या मैंने draw किया? That's the lesser omentum. That's the lesser omentum. And who's present within the lesser omentum? Look at this, students. Who's present within the lesser omentum? Who's this behind portal vein? To the right of the portal vein, ये कौन है? Bile duct. And to the left of the portal vein, that's a hepatic artery. The right is the bile duct. To the left is the hepatic artery, and the पीछे कौन है? Portal. And behind the portal vein, you can see a vein here. Behind the portal vein is what? The IVC. The पीछे होती है IVC. And between the IVC and the portal vein, students, are you getting this? Between the IVC and the portal vein, look at this. यहाँ पे एक foramen होता है. There's a foramen here, and this is what we call as the epiploid. This is what we call as the epiploid foramen. Here. So that's the epiploid foramen. Here. So what are the boundaries of epiploid foramen then? Epiploid foramen के boundaries क्या होंगे? Who's behind? सबसे पीछे क्या होता है? The IVC. सबसे पीछे होती है IVC. Who's anterior to the epiploid foramen? Anterior to the epiploid foramen are three structures: the portal vein, the hepatic artery, and the bile duct. Portal vein, hepatic artery, and the bile duct. Who's above? Okay, now I'm able to see your. Comments. Yes, Khan, are you there? Very good. Very good. I was not able to see you people at all. Okay, Deepa, good evening to all of you. Are you able to follow this? Very good. Yeah. Good. You are all answering. I was not able to see the comments. Now I'm able to see the comments. Very good. So boundaries of epiploid foramen बोल सकते हो बच्चों? Boundaries of epiploid foramen. सबसे पीछे कौन है? Who's behind? The IVC. Who's anterior? The portal vein, the bile duct, and the hepatic artery. Who's superior? What is the superior boundary of epiploid foramen formed by? Can anyone tell me this? The superior boundary of epiploid foramen is formed by, any guesses? Caudate lobe of the liver. And the inferior boundary is formed by the first part of duodenum. Very good. Khan, you're answering very well. Yes, very good. The rest of you also answer, huh? Okay, that's it. What is this artery, bacho? What is this artery here? Can you see this artery? That's the superior artery and vein. Artery. Okay, perfect. Very good. Can anyone tell me this? Look at this, students. Here has stomach. What is this? Less omentum. What is this? Greater omentum. And what is this? ये क्या foramen देख रहे हो ये? That's the epiploid foramen. यही है epiploid foramen. And what are the boundaries of epiploid foramen? Clear है? Anteriorly is the less omentum. Posteriorly, I have told you IVC. Who's above the caudate lobe and who's below the first part of the duodenum. Very good. And who's behind the stomach? Behind the stomach is the lesser sac. Each of the lesser sac. Okay, Coming to the next MCQ, students. A 27-year-old primary gravida has visited your clinic for her routine pregnancy, and as a part of consultation, you explain her the do's and don'ts of pregnancy. During embryological development of the baby, which of the following structures remain unfused and forms a labia minora in? Yes, can anyone answer this? Yes, any guesses? So just remember it like this. बस इतना याद रखो what I'm telling you. Just remember like this. One is genital tubercle. Genital tubercle. Genital folds. Just remember this three. Genital swellings, what do they form? In males, in females. The scrotum or labia. On the scrotum, in males, labia major and female. The genital tubercle, what does it form? Penis in males and clitoris in females. And the genital folds, or these are also known as urethral folds. Genital folds का दूसरा नाम है urethral fold. What do they form? In males, they form the ventral aspect of penis, males, and in females they form the labia minor. बस इतना याद रखना बच्चों. Just remember this much. What I'm telling you. This is extremely important. Extremely important. Yep. Phallus is genital tubercle. Phallus is the genital tubercle. So genital tubercle forms a phallus. Phallus बनता है future penis or clitoris. ठीक है ना? The genital tubercle, it forms a small elevation with phallus. The phallus will form penis in males and clitoris in females. Labioscrotal swelling. Labioscrotal swelling is the genital swellings. Labioscrotal swelling is the genital swelling. What does it form? Forms a scrotum in males and labia in females. And urogenital folds is the urethral folds. What do they form? From the ventral aspect of penis in males and labia minor. So what is the answer for this? Urogenital folds. Am I clear, students? Following this? I hope I'm clear. What are these sino-vaginal bulbs going to form? Can anyone tell me? Yes, sino-vaginal bulbs से क्या बनता है? Yes, any guesses? Sino-vaginal bulbs. Okay, look at this slide. I will see this. Look at this slide. I'll just put this as number 1. What is this number 1? That's the genital tubercle. इससे क्या बनेगा? Penis in males and clitoris in females. Second, what is this number 2? Number 2 is genital swellings. Genital swelling से क्या बनेगा? The scrotum and the labia major. This is number 3. That's the urethral folds. And number 3 is the genital folds. What is it going to form? It forms the ventral aspect of the penis in males on labia minora in females. Clear to all of you, students? क्या ना बच्चों? Fine. Right. Now you tell me, students, what is this? I mean, I'll just write this down for you. A blank slide. Okay. Now, how does the vagina form? The vagina. Vagina is derived from two sources. Vagina is derived from two sources. We make it like this: upper one thirds, the lower. ठीक है. Upper one thirds is derived from para mesonephric paramesonephric. The upper one thirds of the vagina is derived from the paramesonephric duct. The lower one thirds of the vagina is derived from sino-vaginal bulbs. Sino-vaginal bulbs, which is derived from the urogenital sino-vaginal bulbs, which is derived from the urogenital sinus. So this is what in origin then, students? ये क्या होता है origin में? Endodermal. Endodermal in origin, and what is this in origin? Meso. This is mesodermal in origin, and that's endodermal in origin. So vagina is derived from two sources. ये याद रखना बच्चों. The upper one thirds of the vagina is derived from the fused part. The lower two thirds of the vagina is derived from the sino-vaginal bulbs, which are sinus. It is therefore endodermal. Chin. Yes, Khan, here. Yes, Khan. Are you all able to follow? I'll just type this. Fine, students. Look at this. Look at this slide. So, ye kya hai? What is this? This is the paramesonephric duct. That's a paramesonephric duct. And what is this? This is the urogenital sinus. Ye hai urogenital. So this paramesonephric duct forms the upper one thirds of the vagina, and this urogenital sinus forms a bulbs. What is this known as? Sino vagina. And this sino-vaginal bulbs is going to form the lower thirds of the vagina. Okay, that's lower two thirds of the vagina. That's upper one thirds of the vagina. Fine, clear to all of you? Right. Let us proceed then. See you. A 35 years old male or old female comes to the OPD. A newborn child complains of vomiting after feeding. Obstruction to the small intestines was thought of. MRI scan revealed a mass around the second part of it and narrowing of the liver. A diagnosis of the pancreas. All the following are derived from the dorsal pancreatic bud, except, yes, students, answer this. Dorsal pancreatic bud, and look here, just look at this slide. The development of pancreas, another extremely important. So students, I have selected all very, very important MCQs for you. So just remember all these things that we are discussing, right? So what is this bud? That's the ventral pancreatic bud, and ये है foregut, and that's the midgut. At the junction of foregut and midgut, you get a diverticulum. What is this diverticulum? For the liver, it is known as the hepatic diverticulum, and this hepatic diverticulum will form and the gallbladder. At the junction of hepatic diverticulum and the gut, you get a bud here. What is this bud? This is, yes, students, any guesses? This is the ventral pancreatic. And what is this bud? That's a dorsal pancreatic. Dorsal. Okay. So at the junction of hepatic diverticulum and the gut, what is that bud? Ventral pancreatic bud. Opposite side, what is the bud? Dorsal pancreatic. This ventral bud, students, this ventral bud goes from back side, goes and joins with the dorsal. The ventral bud goes and joins with the dorsal bud. Now, what is the dorsal pancreatic bud? The dorsal pancreatic bud से क्या बनता है? It forms the upper part of the head. Dorsal pancreatic bud forms the upper part of the head, neck, body, and tail of the pancreas. Upper part of the head, neck, body, and tail of the pancreas. The ventral pancreatic bud forms. Ventral pancreatic bud forms the lower part of the head. Uncinate process. Lower part of the head and the uncinate. Clear? The ventral pancreatic bud forms the lower part of the head and the uncinate process. Not able to see your comments only. Okay, fine. So the dorsal pancreatic bud is going to form the upper part of the head, neck, body, and tail of the pancreas. The ventral pancreatic bud forms the lower part of the head. ठीक है बच्चों? So normally क्या होता है? The ventral pancreatic bud goes from back side. It goes from behind, goes with the dorsal bud. But sometimes half of the ventral bud goes from back, half of the ventral bud comes from front. And such a type of pancreas is going to encircle the duodenum. What is that known as? Annular pancreas. इसे हम बोलते हैं annular pancreas. The annular pancreas is due to defective migration of ventral pancreatic bud. Remember, only one bud migrates. Defective migration of ventral pancreatic bud results in annular pancreas. Okay, and suppose if these two buds do not fuse, you get a divided pancreas. Divided pancreas, that is what we call as pancreatic division. Pancreatic division, it's divided pancreas. Just have a look at the slide now. What is the answer for this? All the following are derived from the dorsal pancreatic bud except the uncinate process is derived from the ventral bud. Okay, that's it. See the next MCQ, students. Which of the following is derived from umbilical artery? Umbilical artery. Any guesses? Come on, Khan. Any guesses? What is the answer? Which of the following is derived from the umbilical artery? Bolo, bolo. Bolo, bolo. Any guesses? Answer is the medial umbilical ligament. Okay. Now, medial umbilical ligament is nothing but the obliterated umbilical artery. Obliterated umbilical artery is the medial umbilical ligament, and the non-obliterated part of umbilical artery. Non-obliterated part of the umbilical artery is superior vesicle. ये याद रखना बच्चों, umbilical arteries है ना, umbilical arteries, they begin from the internal iliac. Okay, I'll just make it like this. Umbilical arteries, they begin from the internal iliac and they are going towards the umbilicus. And make this as the umbilical. What is this artery? Internal iliac. What are these arteries? Umbilical arteries. So umbilical arteries begins from the internal iliac and they're going towards the umbilicus. On the way comes the bladder, urinary bladder. That's a urinary bladder. Now, this part of the umbilical artery between the bladder and the umbilical, okay, obliterate ho jata. Between the bladder and the umbilicus gets obliterated. This is what we call the medial umbilical ligament. So what is medial umbilical ligament? It's the obliterated umbilical artery. And what is this, students? This is the non-obliterated part of umbilical artery अब ये क्या बनेगा? This non-obliterated part of the umbilical artery, this becomes the superior vesical artery. ये बन जाता है superior vesical. Understanding? Now, in fetal life, students, in fetal life, from the apex of the bladder to the umbilicus. Here, dekho, from the apex of the bladder to the umbilicus. There's a connection from the bladder to the umbilicus. There's a connection. And what is this known as? This. That is known as a urachus or allantois. So what is urachus or allantois? It's a connection from the apex of the bladder to the umbilicus. After birth, this is obliterated, and what is this known as? The N umbilical. So this is the obliterated urachus. But sure, this is the obliterated urachus. Obliterated urachus or allantois after birth becomes the median umbilical ligament. What is medial umbilical ligament? It's the obliterated umbilical artery. It's the medial umbilical. समझ में आ रहा है ना ये? हाँ. So in fetal life, from the apex of the bladder to the umbilicus, what is that known as? Urachus. After birth, this gets obliterated. इसे क्या बोलेंगे? median umbilical ligament. If this does not obliterate, the child passes urine through the umbilicus. This is what we call the weeping umbilicus. Crying umbilicus or weeping umbilicus. Okay. What is ligamentum arteriosum? It is the obliterated ductus arteriosus. Ductus arteriosus याद है? In fetal life, there's a connection between the pulmonary artery and the arch of aorta. In fetal life, there's a communication between the pulmonary artery and the arch of aorta. After birth, this communication obliterates, and this is what the ligamentum arteriosum. What is ligamentum venosum? Ligamentum venosum. One moment. I'll just write it down for you. Ductus venosus. What is ductus venosus? It's a connection between left branch of portal vein and IVC. Yes, so fetal life में होता है. This is all in fetal life. So in fetal life, there's a communication between the left branch of portal vein and the IVC. After birth, this communication is gone. This is what we now call as ligamentum venosum. So ductus venosus का क्या बन गया? Ligamentum. And what is ligamentum teres? Ligamentum teres is the obliterated left umbilical vein. What are the contents of umbilical cord? Students, umbilical cord के contents क्या होता है? What are the contents of umbilical cord? There are 2 umbilical arteries and 1 umbilical vein. ये पता है आपको? 2 arteries and 1 vein. Which vein is that? The left is left. You know this. So contents of umbilical cord, 2 umbilical arteries and the left umbilical vein. This left umbilical vein after birth becomes what? The ligamentum teres. So yes, so clear है ना students? These are very important MCQ. Very, very important MCQ. Okay. Clear to all of you? Fine. So we'll proceed then. If there's anything which is not clear, you tell me. If anything is not clear, you just tell me. You can type it. That's fine. Coming to the okay, look at this. What is this? Number one. That's a median. Number 1. That's a median umbilical ligament. Number 2 is the medial umbilical ligament. This is the urinary bladder. Urinary bladder to the umbilicus. That's a median umbilical. Number 2 is the medial umbilical. What is this? Ligamentum teres. Ligamentum teres. That's a falciform ligament. Okay. ये सब आना चाहिए बच्चों. This is a revision for you. Just revising this. This is the accelerate batch. Okay, accelerate batch. So it's a type of revision. So come on, bachcho. Coming to the next MCQ, number 35. Which of the following is not a branch of first part of maxillary artery? Yes, any guesses? Any guesses? Now this maxillary artery is a terminal branch of which artery? यह है external carotid artery. External carotid artery. The external carotid artery gives two terminal branches. What is this artery? इसका नाम है superficial temporal artery. And what is this artery? The maxillary artery. Superficial temporal and maxillary. Now this maxillary artery is divided into three parts. It is divided into three parts by a muscle. What is this muscle, बच्चों? ये क्या muscle है? Lateral pterygoid. Lateral pterygoid. So the maxillary artery is divided into three by the lateral pterygoid muscle. Lateral pterygoid. So which are the three parts of the maxillary artery? Just have a look at this. Which are the three parts of the maxillary artery? Yep. From its beginning to the muscle, that's the first part. Beginning to the muscle, that's the first part. On the muscle, that's the second part. And between the two heads of the muscle, that's the third part of maxillary artery. So from its beginning to the muscle, what is this part? First part. From its beginning to the muscle, that's the first part. On the muscle, that's the second part. That's the second part of the maxillary artery. And the third part passes between the two heads of the lateral pterygoid muscle. So which is the muscle which divides the maxillary artery into three parts? Lateral pterygoid. Lateral pterygoid. Students, any other muscle dividing any artery, any such artery into three parts? Any other muscle? पता है आपको? Axillary artery. Axillary artery is divided into three parts. By which muscle? Yes, any guesses? Pectoralis minor. Very good. Axillary artery is divided into three parts by pectoralis minor. Subclavian artery is also divided into three parts by Scalenus anterior. Very good, very good. Scalenus anterior. The subclavian artery is also divided into three parts by the Scalenus anterior muscle. Similarly, maxillary artery is divided into three parts by the lateral pterygoid. Lateral pterygoid. अब इसके branches देख लो बच्चों. Branches from the first part. I just mentioned it for you. First part. First part. What are the branches? Deep auricular. Deep auricular. I'll write down for you. Deep auricular. Anterior tympanic. Anterior tympanic. Middle meningeal. Accessory meningeal. Inferior alveolar. Inferior alveolar. So deep auricular, anterior tympanic, middle meningeal, accessory meningeal and inferior alveolar. ये सब याद रखना है आपको. Just remember this branches. That's the first part. Second part के branches. बस ये याद रखना है बच्चों आपको. Second part के branches. One, deep temporal artery. Deep temporal. It supplies the muscles of mastication. So muscles of mastication कौन से हैं? One is temporalis. So the artery is deep temporal artery. Masseter. So the artery is masseteric artery to the pterygoid. Artery to the pterygoid. And third, and the last one is buccal artery. ठीक है? So deep temporal, masseteric artery, artery to the pterygoids, and the buccal artery. That's a branch from the second part. Coming to the third part. Third part of maxillary artery gives one, posterior, superior, alveolar. Okay. Infra orbital, greater palatine, Pharyngeal artery. Pharyngeal artery of pterygoid canal. Spinopalatine. Okay. So posterior superior alveolar, infraorbital, greater palatine, pharyngeal artery of pterygoid canal, and the Spinopalatine. So these are the branches. Okay. Of the third part of maxillary. Students, are you able to follow this? Hello, hello. Very good, very good. And I'm not able to see your chats. You know, very good, very good. Buccinator is not a muscle of mastication, a khan. Buccinator is a muscle of facial expression. Remember, buccinator is not a muscle of mastication. Very good. Voice is clear now? Huh? Voice clear hai Abu? Rabi? Is the voice clear? Okay, fine. So that's the various branches of maxillary artery. So what is the answer for this? Greater palatine. Greater palatine bhi hai na? Okay. So which of the following is not a branch of it's a branch first part of maxillary artery. All these are branches of maxillary artery only. So middle meningeal first part, accessory meningeal first part, inferior alveolar is from the first part. Greater palatine is from the third part. Greater palatine is from the third part. So I've told you the branches of maxillary artery, students. Is this clear to all of you? Yes. Let's remember once again, I'll repeat, maxillary artery is divided into three parts by which muscle? Lateral pterygoid. Similarly, the axillary artery is divided into three parts by pectoralis minor, and the subclavian artery is divided into three parts by scalenus anterior. Very good. What is this? Ek minute, just see the slide. What is this muscle? Can anyone tell me what is this muscle? That's a medial pterygoid. What is this muscle? That's a lateral pterygoid. That's a medial pterygoid. ये क्या nerve है बच्चों? What is this nerve? That's a that's a lingual nerve. That's not inferior alveolar. That's a lingual. And what is this nerve? That's a inferior alveolar. Okay, lingual nerve and inferior alveolar. Perfect. This is clear to all of you. Just remember the slides. Coming to the next MCQ. 54 years old woman comes to the emergency department because of drooping of left side of face since morning. Drooping of left side of face. She also has difficulty in closing her eyes and chewing. That means which nerve is involved? The seventh nerve is involved, and chewing. Which are the muscles which helps in chewing? The muscles of mastication. These are the muscles of mastication. And the muscles of mastication is supplied by which nerve? The mandibular nerve. The fifth nerve. So the fifth nerve is involved, the seventh nerve is involved. During neurological examination, the physician asks to open her jaw against resistance. Which of the following muscles is most likely activated in this movement? Yes, answer this. This is very important. Which is the only muscle of mastication which causes depression of the mandible, helps to open the mouth? That's the lateral pterygoid. Remember, bacho, lateral pterygoid. The only muscle of mastication which causes depression of the mandible is lateral pterygoid. वैसे which are the muscles of mastication? One, masseter. Second, temporalis. The medial pterygoid and the lateral pterygoid. ठीक है? Out of this, right? Temporalis, masseter, medial and lateral pterygoid. These are the muscles of mastication. And all these muscles are going to cause what? All these muscles are going to cause elevation of the mandible, except the lateral pterygoid causes depression of the mandible. ये clear है? The only muscle of mastication which causes depression is lateral pterygoid. Perfect. Just remember this, huh? वैसे muscles identify कर लो बच्चों. Buccinator is not a muscle of mastication. Buccinator is not a muscle of mastication. Buccinator is a muscle of facial expression. It's a muscle of facial expression, and it is supplied by which nerve? It is supplied by the facial nerve. Facial nerve. The muscles of mastication are supplied by the mandibular division of trigeminal. The mandibular nerve. Bachcho, can you identify this muscle? That's the temporalis. Temporalis. What is this muscle? That's the masseter. That's a masseter. That's a temporalis. What is this muscle? It's a buccinator. Yeah, buccinator. And students, what is this structure which is piercing the buccinator? This is a structure which pierces the buccinator and opens inside the mouth. What's that? The parotid. That's a parotid. The structure which pierces the buccinator and opens inside the vestibule of the mouth, that's the parotid duct. Clear hai? So be very clear about this. Plenty of MCQs on this. Okay. What is this muscle? ये है lateral pterygoid. And what is this? Medial pterygoid. ये lateral pterygoid है and ये medial pterygoid. And what is this, students? That's the articular disc. Articular disc. The articular disc of a TM joint is the degenerated part of lateral pterygoid. Remember this. The articular disc of TM joint is the degenerated part of which muscle? Lateral pterygoid. Lateral pterygoid. Okay. Coming to the next MCQ, students. Cavernous sinus is related to all the following except. Can anyone answer this? Students, can anyone answer this MCQ? A very, very important MCQ. Very important MCQ. Very, very important MCQ. Come on, bachcho, come on. Can anyone answer this? Cavernous sinus is related to all the following. Yes? Okay, I'll just make a slide of cavernous sinus for you, students. बहुत important MCQ है. Look, I make this as the cavernous sinus. ये है cavernous sinus. This is of the left side. अपना left side. In your body, left side. अगर ये cavernous sinus है, who's medially related to the cavernous sinus? What is this structure? In the medial wall of the cavernous sinus, that's a pituitary gland. Pituitary gland. And who's this below? ये नीचे क्या होता है? That's an air sinus. What is this air sinus? Sphenoidal air. This is the sphenoidal. That's a pituitary gland, and that's a sphenoidal sinus. That's in the medial wall. These are the medial wall of the cavernous sinus. Lateral wall of the cavernous sinus, there are 4 nerves related. That's a third nerve. That's a fourth nerve. This is the ophthalmic division of the trigeminal nerve. That's a maxillary division of trigeminal. The lateral wall of cavernous sinus, which are the structures related? The third nerve, the fourth nerve, the ophthalmic division, and the maxillary division of trigeminal. In the floor, what's this nerve? That's a sixth nerve. Sixth nerve. And what is this big artery here, students? That's the internal carotid artery. And what's this in the roof of the cavernous sinus? The roof is the optic chiasma. So in the roof of the cavernous sinus is the optic chiasma. In the floor is the sixth nerve and the internal carotid artery. Medially is the pituitary gland and the sphenoidal air sinus. And in the lateral wall, the third nerve, the fourth nerve, the ophthalmic division and maxillary division of trigeminal nerve. बस ये slide याद रखना. Just remember the slide. So if there's any MCQ of cavernous sinus, you should be able to answer this. If cavernous sinus thrombosis hota hai, so what are the structures affected? That is what the MCQ is. Okay. So what is the answer for this? Looking at this slide, cavernous sinus is related to all the following except oculomotor nerve, yes, in the lateral wall, internal carotid artery, yes, in the floor, maxillary nerve, yes, in the lateral wall. Mandibular nerve is not related at all to the cavernous sinus. Mandibular nerve is much away from the cavernous sinus. ये बहुत दूर होता है cavernous sinus से. Clear? So that's how the cavernous sinus is. I hope this is clear to all of you students. This is the cavernous sinus. So I've told you the relations of the cavernous sinus. That is what the MCQs. See the next. The middle meningeal artery passes to which foramen? Any guesses, students? Any guesses? Middle meningeal artery passes to which foramen? Yes, middle meningeal. That's the foramen spinosum. Foramen spinosum. So we'll just finish this. Foramen rotundum, what passes? Any guesses? Foramen rotundum is a maxillary nerve. Foramen rotundum se what goes is a maxillary nerve. Foramen ovale, what goes is M-A-L-E, male. What's M? M, students, M? M is muscular nerve. A, accessory meningeal artery. L, lesser petrosal nerve. E, emissary vein. So male, M-A. Okay, so mandibular nerve. A is the accessory meningeal artery, L is the lesser petrosal nerve, and E is the emissary vein. Foramen spinosum, what passes is middle meningeal artery, nervous spinosus, middle meningeal artery and nervous spinosus that passes to foramen spinosum. Baaki jugular foramen. Jugular foramen, students. Jugular foramen has got three compartments: anterior, middle, posterior. Anterior compartment, middle compartment, and posterior compartment. Okay. Now, what passes to the anterior compartment of the jugular foramen is the inferior petrosal sinus. Inferior petrosals. What passes to the middle compartment? That's 9, 10, and 11 cranial nerves. 9, 10, and 11 cranial nerves. And what passes to the posterior compartment? Sigmoid. The sigmoid sinus later becomes what? The internal jugular vein. Sigmoid sinus का क्या बनता है? Internal jugular. ठीक है? Here to all of you, just remember the way I'm telling you. Just remember this MCQs. This I've handpicked MCQs. These are very important for you, बच्चों. Very important for you. Okay. In case of doubts, do get back to me. So, jugular foramen के तीन compartments हैं: anterior, middle, and posterior. Anterior compartment, what passes is the inferior petrosal sinus. Middle compartment is the 9th, 10th, and 11th cranial nerve. And third is the sigmoid sinus. Sigmoid sinus. Clear? Okay. Fine. Coming to the next MCQ. Ansa cervicalis does not supply. Anyone? Can anyone answer this? Ansa cervicalis does not supply. I'll draw this for you. I'll draw this. Now, which is the nerve which goes to supply the tongue? Which is the nerve? What is Ansa cervicalis? Just understand. This is the hypoglossal nerve, bachcho. That's a hypoglossal nerve which is going to supply the tongue. Hypoglossal nerve going to supply the tongue. These are the C1, C2 and C3. C1, C2, C3. Let's start. The fibers of C1, they go with the hypoglossal nerve. So, fibers of C1 accompany the hypoglossal nerve. After a short distance, they leave the nerve as one. This is the meningeal branch. Meningeal branch of C1. Meningeal branch of C1. Second is the nerve to hyrohyoid. Hyrohyoid and geniohyoid. Thyroid and geniohyoid. And there's one branch which is descending down. What do you call this as? This is known as the descending hypoglossi, or this is what we call as the superior root of Ansa cervicalis. Superior root of Ansa cervicalis. Okay. So fibers of C1, they go with the hypoglossal nerve. After a short distance, they leave the nerve as one, the meningeal branch of C1, the nerve to thyrohyoid and geniohyoid. Students, if you get an MCQ stating nerve supply of thyrohyoid and geniohyoid, what is your answer? C1. C1. Nerve supply of thyroid and geniohyoid is C1. C1, remember. C1 gives the third branch. What is that known as? Descending hypoglossi, or it is also known as the superior root of Ansa cervicalis. Superior root of Ansa cervicalis. Now, C2, C3 से दो, C2, C3, we get the second branch. What is this known as? This is known as the descending cervicalis or inferior root of Ansa cervicalis. C2, C3 forms the descending cervicalis or the inferior root. The inferior root joins with the superior root and forms Ansa cervicalis. ये बन गया Ansa. So how is the Ansa cervicalis formed? C1, C2, C3. C1, C2, C3 से बनता है Ansa cervicalis. Fibers of C1 and fibers of C2, C3, they form the Ansa cervicalis. Okay. Now what is this Ansa cervicalis supply? It supplies the sternohyoid muscle, the sternohyoid. It supplies sternohyoid, sternothyroid, superior belly of omohyoid, and inferior belly of omohyoid. So what is the Ansa cervicalis supply? It supplies the sternohyoid, sternothyroid, the superior and the inferior belly of omohyoid. Students, which strap muscle is not supplied by Ansa cervicalis? Strap muscles कौन से होते हैं? Sternohyoid, sternothyroid, hyrohyoid and omohyoid. These are the strap muscles. Out of which sternohyoid, sternothyroid and omohyoid are supplied by Ansa cervicalis. Which strap muscle is not supplied by Ansa cervicalis? Geniohyoid. This is very important, students. याद रखना. Geniohyoid is supplied by whom? C1. C1 supplies which other muscle? Hyrohyoid. Hyrohyoid and geniohyoid is supplied by C1. Just remember this. Clear to all of you? Okay. And this Ansa cervicalis lies on. What is this Ansa cervicalis lies on? It lies on the anterior wall of carotid sheath. Anterior wall of carotid sheath, the Ansa cervicalis. The Ansa cervicalis does not supply. Answer is thyroid. Thyroid is supplied by C1. Okay. And this Ansa cervicalis lies on anterior wall of carotid sheath. Okay, bachcho, clear hai? Coming to the next MCQ, students. A 40 years old patient complains of dryness of mouth. On examination, there was absence of secretion from parotid gland. Which cranial nerve carries parasympathetic fibers to this gland? Yes. Any guesses? Any guesses? Which is the nerve which supplies the parotid gland? Any guesses, bachcho? Yes, very good, Khan. Very good, very good. Only Khan is answering. What about the others, bacha? Answer, everyone. All of you, be interactive. It will be easy for you. Okay. So, which is the cranial nerve which supplies the parasympathetic fibers to the parotid gland? Which is that cranial nerve? That's the glossopharyngeal nerve. Glossopharyngeal nerve supplies the parotid gland. What is the facial nerve supply? The facial nerve supplies the submandibular, submandibular gland, sublingual gland, nasal, palatine, pharyngeal. Nasal glands, palatine glands, pharyngeal glands, the submandibular and the sublingual glands. This is supplied by facial nerve. Vagus nerve क्या supply करता है? The glands of GIT. That's supplied by the vagus. Trigeminal nerve, you know, it divides into ophthalmic, maxillary and mandibular nerves. You know this, no? Trigeminal nerve के 3 branches हैं, ophthalmic, maxillary and mandibular. The trigeminal nerve supplies the sensory supply to the face. The sensations from the face are carried by the trigeminal nerve except, can anyone answer this? Sensations from the face are carried by the trigeminal nerve, entire face except the skin over the angle of mandible. Here. The skin over the angle of mandible is supplied by whom? The greater auricular nerve. Greater auricular nerve. ये पता है ना आपको? This is a very important MCQ. The entire face sensory supply is by whom? Trigeminal nerve except the skin over the angle of mandible, and this is supplied by the greater auricular nerve. The greater auricular nerve is a branch of cervical plexus. Coming to the next one, students. A 43 years old woman came with a large abscess in the middle of the right posterior triangle of the neck. The physician incised and drained the abscess. 5 days later, the patient noticed that she cannot extend her right hand above her head to brush her hair. What is that? The patient cannot extend her hand above her head. What is that? That's overhead abduction. Overhead abduction is lost. And this overhead abduction is done by 2 muscles. ये मैंने बोला आपको बच्चों. Overhead abduction of the arm is done by 2 muscles. One, serratus anterior and trapezius. Right? This overhead abduction, देखो, cannot extend her right hand above her head. That's overhead abduction done by whom? Serratus anterior and trapezius. What's the nerve supply of serratus anterior? That's a nerve to serratus anterior. And what's the nerve supply of trapezius? That's a spinal accessory. Right? Okay. So, which of the following are the signs and symptoms of additional harm? That means in the posterior triangle of the neck, what are the contents of the posterior triangle? आपको पता है? Have a look at it. Okay, I'll just make this for you. That's a mastoid process. What is this muscle, students? Sternocleidomastoid. ये कौन होता है पीछे? Trapezius. That's the body. That's the ramus of the mandible. This is the midline of the neck. This is the clavicle here. This is a line drawn from the angle to the mastoid process. So this is the neck. What are the boundaries of the neck? Anteriorly is the midline of the neck. Posteriorly is the trapezius. Below is the clavicle. Above is the mandible. And the line joining the angle to the mastoid process. This neck is divided into 2 triangles by the sternocleidomastoid. अब ये क्या triangle है? Anterior. And what is this triangle? Posterior triangle. What is this bone, students? Hyoid bone. Hyoid. And what is this muscle? Yes, koi bol sakta hai, what is this muscle here? This is the omohyoid. Omohyoid. What is this? Number 1, that's the superior belly, and number 2 is the inferior belly of omohyoid. Superior and inferior belly of omohyoid. Okay. The inferior belly of omohyoid divides the posterior triangle. Okay. The inferior belly of omohyoid divides the posterior triangle with further 2 triangles. What is this triangle? Occipital triangle. And what is this triangle below? ये clavicle के ऊपर है. What do you call this as? The supraclavicular triangle. Supraclavicular. So that's the occipital triangle and that's the supraclavicular. Right? एक और muscle होता है बच्चों. There's one more muscle. It has got 2 bellies. Can anyone tell me which is the muscle which has got 2 bellies? The digastric. The digastric also has 2 bellies. What is this belly of digastric? That's the posterior belly of digastric. That's the anterior belly of digastric. आगे क्या होता है? Anterior belly, and the one behind is the posterior belly of digastric. Okay, right, students? That's the anterior belly of digastric, and that's the posterior belly of digastric. So anterior triangle is further divided into many triangles. So what is this? I'll just put number 1. I'll just put numbers here. What is this? Number 1 here. That's the muscular triangle. Muscular triangle. What is this triangle? Parotid triangle. Parotid. What is this? Digastric triangle. Digastric. And what is this triangle? Submental triangle. That's a submental triangle. So what are the parts of the anterior triangle of the neck? That's a muscular triangle, that's a carotid triangle, that's a digastric triangle, and this is the submental triangle. Posterior triangle के parts क्या होता है? What is this triangle? Occipital, and ये कौन है? That's a supraclavicular triangle. Supraclavicular. Posterior triangle is further divided into 2 parts. What is that? One is the occipital triangle, and the other one is the supraclavicular triangle. ये सब याद रखना बच्चों. This is very important. I'll just name the muscles for you. What is this muscle? What is this? Number 1. एक मिनट. What is this muscle? That's an inferior belly of omohyoid. That's an inferior belly. Inferior belly of omohyoid. And what is this muscle? ये क्या होता है? That's a superior belly. Superior belly of omohyoid. Right. What is this muscle here? That's a posterior belly of digastric. The anterior belly of digastric. Clear to all of you? So I've just told you the triangles in short. Triangles bola. Now understand what are the contents of posterior triangle. The contents of posterior triangle of the neck. This is another very important topic. Contents of posterior triangle of the neck. Yes, any guesses? Anyone has the contents? Any guesses? Chalo. I'll just write here for you. Contents of the posterior triangle of the neck. 1 is brachial plexus, subclavian artery, spinal accessory nerve, cervical plexus. So the brachial plexus, the subclavian artery, the spinal accessory nerve, the cervical plexus, occipital artery. Occipital artery. So these are the contents of the posterior triangle of the neck. Out of all this, students, which is the most important content of the posterior triangle? The most important content of the posterior triangle is the spinal accessory nerve. And why is this posterior triangle so important? Because in this posterior triangle you get plenty of lymph nodes here. यहाँ पे बहुत सारे lymph nodes होते हैं, and this lymph node becomes matted in tuberculosis. So when we are removing this lymph nodes, accidentally the accessory nerve gets damaged. So damage to the spinal accessory nerve in the posterior triangle of the neck would lead to spinal accessory nerve is gone. So difficulty in shrugging of shoulders, 1. Difficulty in overhead abduction, number 2. And third is bringing of scapula at rest. Okay? So just remember all this. This is very important. So I will explain you everything, bacho. Come on, answer this. Number 42nd. Which of the following is a muscle of third pharyngeal arch? Now this pharyngeal arches you have to know very, very clearly. Pharyngeal arches. Derivatives. First arch का nerve कौन सा है? Which is the nerve? The first arch, mandibular. Second arch, facial. Third arch की nerve is glossopharyngeal. Fourth and sixth arch is vagus. Now you tell me, stylohyoid muscle is a muscle of second pharyngeal arch. Mylohyoid is a muscle of the first pharyngeal arch. Cricothyroid is a muscle of the fourth pharyngeal arch. And stylopharyngeus is a muscle of the third pharyngeal arch. Which is the nerve of the third pharyngeal arch? Glossopharyngeal nerve. Which is the nerve of the second arch? Facial nerve. Which is the nerve of the first arch? Mandibular nerve. And which is the nerve of the fourth arch? That's a superior laryngeal nerve. Which is the nerve sixth arch? The recurrent laryngeal nerve. Sixth arch की nerve है recurrent laryngeal. Okay. Dear students, just remember this, and these are MCQs are extremely important. Clear? Fine. So answer for this: muscle of the third arch, stylopharyngeal. The nerve of the third arch, glossopharyngeal nerve. Okay. See the next muscle which helps in protrusion of tongue. A very, very, very important MCQ, students, and a very easy MCQ. These are scoring MCQs. Muscle which helps in protrusion of the tongue. Any guesses? That's a genioglossus. Yes, genioglossus is the muscle which helps in protrusion of the tongue. Genioglossus is therefore known as safety muscle of the tongue. Safety muscle of the tongue is genioglossus. So what happens? What is the action of genioglossus? It helps in protrusion of tongue. Protrudes the tongue. अगर ये genioglossus paralyzed हो गया, the tongue will fall back. Protrusion is lost. The tongue falls back and obstructs breathing. Will obstruct to breathing. So which is the muscle which helps in protrusion of tongue? Genioglossus. It is supplied by which nerve? The hypoglossal. Supplied by the hypoglossal. Okay, that's genioglossus. Coming to the next one, this is genioglossus. This muscle is a genioglossus. What is this muscle? Hyoglossus. This is the hyoglossus. Come on, students, see the next MCQ. Number 44. A 40 years patient complains of tears rolling out of the eyes while having food. Is also inability to tolerate loud sounds. On examination, there is loss of sensations on the anterior 2/3 of the tongue. The pain and temperature sensations are in. The person is not able to whistle. Lesion is located at. Yes, answer this. Loss of sensations on the anterior 2/3 of the tongue. So who's involved? Cardiac impact. Tear rolling out of the eyes, inability to tolerate loud sounds, loss of taste sensation. So the answer is facial nerve proximal to the geniculate ganglion. Facial nerve proximal to the geniculate ganglion. I'll just draw this for you, students. Tell me, the facial nerve enters into which foramen of the skull? That's the internal acoustic meatus. The facial nerve enters the internal acoustic meatus enters the internal ear. From the internal ear, it comes to the middle ear cavity. It undergoes a bend. What is this bend known as? Genu. Genu. It undergoes a bend. Okay. That's the first genu of the facial nerve. The facial nerve now runs in the middle ear cavity. It goes in the middle ear cavity. Again undergoes a bend. What's that bend? The second genu. And now it gets out through the stylomastoid foramen. Stylomastoid foramen, the facial nerve enters a gland here. What's that? Parotid. है ना, ये parotid gland आ गया. And the facial nerve then gives us five. Gives the five branches. So what are the branches of facial nerve? The facial nerve first enters the internal acoustic meatus, enters the internal ear. From the internal ear, it comes in the middle ear cavity. There goes a first bend, that's genu. It runs inside the middle ear cavity. There goes a second genu, second bend, then gets out to the stylomastoid foramen. Right? In the ear, the facial nerve gives three branches. One is greater petrosal nerve. Greater petrosal nerve. Second one is the nerve 2. Repeat. Third one is cauda tympani. Okay, so these are the three branches of facial nerve in the ear. What is the greater petrosal nerve supply? The greater petrosal nerve supplies the gland. It supplies all the glands except, students, this is extremely important. The greater petrosal nerve supplies all the glands except parotid. So if the greater petrosal nerve is injured, there will be a loss of secretions from the gland. Nerve to stapedius. What does it supply? Stapedius. It supplies the stapedius. What is the action of stapedius? Yes, sound को damp करता है. It dampens the sound. If the stapedius is damaged, the dampness is gone. What is that known as? Hyperacusis. And what is the cauda tympani supply? The cauda tympani supplies taste sensations to the anterior 2/3 of the tongue. Supplies taste sensations to the anterior 2/3. It also supplies the submandibular and the sublingual gland. Submandibular and the sublingual gland. Okay. And after coming out to the stylomastoid foramen, what is the facial nerve supply? The muscles of facial expression. Now, students, if the facial nerve is injured here, what is this known as? Bell's palsy. If the facial nerve is injured here, this is known as Bell's palsy. There will be a paralysis of the face. Okay, the entire half of the face is paralyzed. अगर injury यहाँ पे है, just above the stylomastoid foramen, in addition to facial paralysis, the person will complain of loss of taste sensations from the anterior of the tongue, loss of secretions from the submandibular and the sub. This will be intact, this will be intact. If the lesion is here, in addition to all this, the person will have hyperacusis. And last, if the lesion is here, there will be a loss of secretions from all the glands except parotid. Okay, understood this? So this is the easiest way to understand the facial nerve. The easiest way to understand the facial. Okay. Clear to all of you? Facial nerve in the stylomastoid, in the parotid. What is this palsy? Bell's palsy. ये होगा Bell's palsy. Cauda tympani in the infratemporal fossa, loss of secretions from the submandibular and the sublingual gland. In addition, there will be a loss of taste sensation. Okay, so answer is A for this. A. Coming to the next MCQ. Anterior inferior cerebellar artery. Students, anterior inferior cerebellar artery is a branch of basilar artery. It's a branch of basilar artery. Vertebral artery is a branch of subclavian artery. Middle cerebral is a branch of internal carotid. It's a branch of internal carotid. So basilar artery के branches हैं anterior inferior cerebellar artery. Which are the other branches of basilar artery? One, I'll just name this for you. The other branches of basilar artery is one, pontine branches. Pontine branches, second. Labyrinthine artery, third. Anterior, inferior, cerebellar, anterior inferior cerebellar, superior cerebellar, posterior cerebral, posterior cerebral. So pontine branches, labyrinthine artery, anterior inferior cerebellar, the superior cerebellar, and the posterior cerebral artery, posterior cerebellar. Okay, just remember this, branches of basilar artery. Coming to the next MCQ. A 71 years old man is brought to emergency department because of difficulty in speaking. His symptoms become abruptly 1 hour ago when he was having dinner with his wife. He has hypertension and type 2 diabetes. Patient speaks slowly in short simple sentences and has difficulty in repeating sequence of words. He frequently omits articles and prepositions, appears frustrated at the inability to speak. Based on his symptoms, which of the following areas of the normal brain is most likely? क्या लगता है? What is the answer for this? Difficulty in speaking. Yes. Which is the area which helps a person to speak? That's 44-45. And what is this known as? This is what we call as the Broca's area. So Broca's area is the motor speech area. Motor speech area. Matlab a person wants to talk, but the person is not able to talk. So where is the lesion? The lesion is in the Broca's area. Broca's area. That's 44-45. What is 22? 22 is the Wernicke's area. It is also known as the sensory speech area. Sensory speech area. Area number 4 is the primary motor area. Primary motor area. And area number 41-42 is primary auditory area. 41-42 is primary auditory area. 44-45 is Broca's area. 22 is Wernicke's area. 4 is primary motor area. So the answer is 44-45. That's Wernicke's area. Okay, na students, are you all able to follow this? Yes, bachcho. Come on, coming to the next MCQ. Here we go. A 62 years old hypertensive male forgets to take blood pressure for medicines. Very good. Very good, Khan. Next morning, he develops hemiplegia of the right side. A widespread lesion of internal capsule was diagnosed. Corticonuclear fibers pass through which limb of the internal capsule? Students, answer this. This is another extremely important MCQ. I specially handpicked the MCQs for you. Students, itna MCQs kar lo. Most of the things here to you. So, corticonuclear fibers pass through the genu of the internal capsule. Genu, corticonuclear fiber. What passes to the posterior limb is the corticospine. Corticospine. Another very important MCQ. Posterior limb is a corticospinal fiber. Retrolentiform part, and which is the last part? Sub lentiform, the internal capsule. Okay, so retrolentiform part. So what passes to the retrolentiform part of the internal capsule? Anyone? That's the optic radiation. Optic radiation passes to the retrolentiform, and sublentiform part is the auditory radiation. Auditory radiation passes to the sublentiform part. Optic radiation passes to the retrolentiform part of the internal. This is very important. Right? Students, clear? So corticonuclear fibers pass to the genu of the internal capsule. Posterior limb, corticospinal fiber. Retrolentiform part, optic radiation. Sublentiform part is the auditory radiation. To the next MCQ. Okay, look at this, students. What is this? What is this structure? That's the internal capsule. What is this limb of the internal capsule? Anterior limb. What is this bend? Genu. What's that? Posterior limb. What is this part which goes behind? That's the retrolentiform. And the part which goes below the lentiform nucleus, that's a sublentiform. What is this nucleus? That's a caudate nucleus. What is this? That's the thalamus. ये कौन है? Lentiform nucleus. Okay, so caudate nucleus, thalamus, and the lentiform nucleus, the one in between the white matters, are the internal capsule. Answer this. Come on, students, answer this. Name the nerve marked by the black structure. Yes. So what is this? Anyone? Can you tell me what is this structure? That's a pons. And what is this structure? That's a medulla. Okay, pons is medulla. What is this? This is the pyramids. This is the olives in the medulla. The first elevation is the pyramid. Next to the pyramids, what do you get? Olives. And next to the olives is the inferior cerebellar peduncle. Inferior cerebellar peduncle. What is this junction known as? This junction is known as the pontomedullary junction. That's the pontomedullary junction. At this pontomedullary junction, there are three nerves which are attached here. Which are the nerves attached here? That's the sixth nerve, that's the seventh nerve, and this is the eighth nerve. Sixth, seventh, and eighth nerves, they are attached to the pontomedullary junction. So what is marked here? जो marked structure है, which is that nerve? That's the sixth nerve. Sixth nerve. So the medial most nerve attached to the pontomedullary junction is sixth, and the lateral most nerve attached to the pontomedullary junction is the eighth nerve. What is this nerve, students? कोई बोल सकता है? This is the fifth nerve. Fifth nerve. The nerve attached at the junction of the pons with the middle cerebellar peduncle is the fifth nerve. Pons with the middle cerebellar peduncle. That's a fifth nerve. Okay. What is this in marked arrow? ये क्या होता है? These are the mammillary bodies. Mammillary bodies. Okay, the two rounded bodies. These are the mammillary bodies. Very good, students. Come on, students. Last MCQs left. Be quick and answer this. Cerebellum is connected to the brainstem by peduncles. The inferior cerebellar peduncle connects the medulla to the cerebellum. All the following fibers pass through it. So what are the fibers passing to the inferior cerebellar peduncle? Olivocerebellar, yes. Vestibulocerebellar, yes. Cuneo-cerebellar, yes. What doesn't pass through it is the tectocerebellar. They pass through the superior cerebellar peduncle. Superior cerebellar peduncle. The tectocerebellar fiber. Okay. Olivocerebellar, vestibulocerebellar. What else passes to the inferior cerebellar peduncle? Posterior spinocerebellar. Posterior spinocerebellar. Okay. So olivocerebellar, vestibulocerebellar, cuneo-cerebellar, the posterior spinocerebellar pass through inferior cerebellar peduncle. Tectocerebellar fibers pass to the superior cerebellar peduncle. Superior cerebellar. What fibers pass to the middle cerebellar peduncle? Middle cerebellar peduncle is the pontocerebellar. Pontocerebellar fibers pass to the middle cerebellar peduncle. These are extremely important. Students, जो भी मैंने बोला आपको, what are points that we have discussed, be very clear about this and keep on revising this. These are all very important MCQs for your exams. Right? See the next MCQ. 15. Okay, what is this? That's the pons. That's the cerebellum. ये है middle cerebellar peduncle. What is this nerve attached at the junction of the pons with the middle cerebellar peduncle? That's a fifth nerve. The nerve attached at the junction of the pons with the middle cerebellar peduncle is the fifth nerve. ये है pons, ये है middle cerebellar peduncle. So what is this nerve? Fifth nerve. Students, coming to the next MCQ. Here we go. Number 50. A 60 years old woman complains of bitemporal loss of vision. Bitemporal loss of vision. Examination reveals A bitemporal hemianopia. MRI reveals pituitary tumor compressing optic chiasma in the region of interpedunclar fossa. All the following structures are related to this fossa except. So what are the boundaries of interpeduncular fossa? Students, look at this. Okay, I'll draw this for you. Interpeduncular fossa. This is the optic nerve. That's the optic chiasma. This is the optic tract. Okay. This is the crus cerebri, midbrain. That's the pons. That's the medulla. These are the pyramids. These are the olives. That's the inferior cerebellar peduncle. Okay. The pyramids, the olives, the inferior cerebellar. That's the middle cerebellar peduncle. Now, students, can you see this area? This area is known as the interpeduncular fossa. What are the boundaries of this interpeduncular fossa? Whose anterolateral? Anterolateral is the optic tract. And whose posterolateral? Posterolateral is the crus cerebri. Anterolateral is the optic tract, posterolateral is the crus cerebri, and what is the floor of the interpeduncular fossa formed by? The floor is formed by the pituitary stalk, the mammillary bodies, and the posterior perforated substance. So, the mammillary bodies and posterior perforated substance. What are the contents of this fossa? The contents of this fossa are the third nerve, that's a third nerve, and the circle of third nerve and the circle of Willis. These are the contents of the interpeduncular fossa. Okay, third nerve and the circle of Willis. Clear to all of you? Okay, just have a look at this slide. Look. This is the optic tract. That's a crus cerebri. These are the mammillary bodies. This is the posterior perforated substance. What is this nerve? That's a third nerve. So this becomes the interpeduncular fossa. Okay. So what is the answer for this? All the following structures are related to the interpeduncular fossa. Crus cerebri, yes. Mammillary bodies, yes. Posterior perforated substance, yes. What is not related here? Is the fourth nerve. The fourth nerve is not related to the interpeduncular fossa. Which is the nerve related to the interpeduncular fossa? Third nerve. And circle of Willis. Okay. Okay, students. What is this number 5? What is this 51 slide? The pointed arrow. What is this triangular structure seen here? The triangular structure here is, this is the vagal triangle. And what is this triangle? Yes, any guesses? This would be the hypoglossal triangle. The pointed structure is the hypoglossal. Next to the hypoglossal triangle is the vagal triangle. And how is the hypoglossal triangle formed? Because of the hypoglossal nucleus. Hypoglossal nucleus hota hai uske andar. And how is the vagal triangle formed? It is formed by the dorsal nucleus of Willis. And what are these elevations here? This is what we call it the facial follicle. And this facial follicles is formed by what? They are formed by the fibers of facial nerve as they wind around the abducens nucleus. The fibers of facial nerve as they wind around the abducens nucleus. Okay, so this is the facial follicle. That's the facial folliculus. This is the floor of the fourth ventricle. In the upper part, the rounded elevations is known as the facial folliculus. And this is formed by the fibers of facial nerve as they turn around, as they wind around the abducens nucleus. This is the hypoglossal triangle which is formed by the hypoglossal nucleus, and that's a vagal triangle. It's formed by the dorsal nucleus of vagus. Number 52. The anterior neuropore closes by, yes students, what is the answer for this? When the neural tube is being formed, it is open and then it starts to close. It closes in the cervical region. Slowly it closes in front, slowly ये पीछे close होता है. The anterior end is still open. इसे क्या बोलते हैं? What do you call this as anterior neuropore or the cranial neuropore? The posterior end is known as the caudal neuropore. The cranial neuropore or the anterior neuropore closes by 25th day, and the posterior neuropore closes by 28th day of intrauterine life. Posterior neuropore by 25th, and 25th is anterior, posterior is 28th day. If the anterior neuropore does not close, it results in anencephaly. If the posterior neuropore does not close, it results in spina bifida. Okay. The anterior neuropore closes by 25th day. If it does not close, anencephaly. Posterior neuropore closes by 28th day. If it does not close, spina bifida. Okay. Fine. Students, this is anencephaly here. This is spina bifida. Number 53. A newborn has multiple congenital defects owing due to dysgenesis of neural crest. Which of the following cells is most likely to be spared? So what are the neural crest cells derivative? The ganglion cells, yes. The melanocytes, yes. The parafollicular C cells, yes. The ganglion cells, the melanocytes, yes. The motor neurons. Which of the cell is most likely to be spared, students? The motor neurons. The motor neurons are not derived from the neural crest, right? Derivatives of neural crest cell, that's another very important topic. Derivatives of neural. I'll just enumerate what is the neural crest cells forms. One, they form, yes, neural crest cells ke derivatives. They form the leptomeninges, they form the melanocytes, they form the endocardial cushion, they form the aorticopulmonary septum, they form the parafollicular C cells of thyroid, they form the corneal stroma, odontoblast, melanocytes, right? Number 54. Trachea is lined by one of the following epithelium. What is the answer for that? Pseudostratified ciliated columnar. Pseudostratified ciliated columnar with goblet cells. Epithelium of trachea. Simple squamous epithelium lines the simple squamous blood vessels, that is known as endothelium. It lines the peritoneal cavities, that is known as mesothelium. Simple squamous epithelium lines the loop of Henle. Okay. Transitional epithelium is urothelium. Stratified cuboidal epithelium is found in the ducts. So trachea is lined by pseudostratified ciliated columnar with goblet cells. Coming to the last MCQ of the day, students, what is this pointed structure? Yes, that is soft palate. This is the soft palate. And all the muscles of soft palate are supplied by what? All the muscles of the soft palate are supplied by pharyngeal plexus, except, can you tell this? The soft palate, all the muscles of soft palate are supplied by pharyngeal plexus except the tensor palati. Tensor palati, which is supplied by mandibular nerve. That's a mandibular nerve here. So all the muscles of soft palate are supplied by pharyngeal plexus except tensor palati, which is supplied by mandibular nerve through the nerve to medial pterygoid. So that's a pointed structure, soft palate. I hope, students, all the MCQs are clear to you. All your doubts are solved. Just revise this MCQs. I have handpicked MCQs for you. So revise this MCQs. Be clear with your concepts. I'm sure you'll be able to crack your FMGE exams. All the best, students, for your All the best for your exams, and thank you for patiently. Thank you to all of you. Thank you.